First of all, I would like to thank the organizing committee of the annual conference of All India Ophthalmological Society. My talk today is the methods of macular evaluation. Anatomical background: macula is a round area at the posterior pole, temporal to the optic disc, about 5.5 millimeter in diameter. Its yellowish color is derived from the presence of xanthophyll pigment. Perifovea, parafovea, fovea, and fovea. Specific anatomic configuration of the fovea: densest concentration of cones. Cones are more elongated and cylinder. Absence of rods of the fovea. Retinal pigment epithelial cells are taller, thinner, and deeply pigmented. Presence of xanthophyll pigment. This special anatomy enables the fovea for highest discriminative ability, color vision, and color perception. Uses of macular evaluation test: diagnosis and follow-up of macular disease, for evaluating the potential macular function in eyes with opaque media such as cataract and dense vitreous hemorrhage. Clinical assessment of macula, like central vision impairment, metamorphopsia, micropsia, and macropsia. Classification of function tests with clear media and opaque media. Regarding clear media, could be visual acuity, contrast sensitivity, slit lamp biomicroscopy, direct and indirect ophthalmoscopy, Photostress test, color vision, ampular glade, microperimetry, fundus autofluorescent, OCT, Wadzik-Allen dark adaptometry. With opaque media, pupillary reaction, Maddox rod test, and so on. We select some tests which are reliable, like contrast sensitivity. Contrast sensitivity test is a measure of the minimum amount of contrast needed to distinguish a test object, and directly assess the quality of vision, and can detect early subtle visual loss when visual acuity is normal. Compare and contrast right and left picture. What are the aims of uses of contrast sensitivity? Is to detect retinal condition like diabetic retinopathy, age-related macular degeneration, and other retinal, macular, and optic nerve disease. Optical conditions like refractive errors and refractive surgery. Look at this grating, spatial frequency, the number of dark and light cycles per visual angle. In macular disease, there is a marked impairment for the intermediate and higher spatial frequency. We rely on Hamilton-Weil contrast sensitivity chart, is an effective test for monitoring potential decreases in contrast sensitivity function over time. We select some tests which are very important, like Photostress test. Involves exposing the macula to the light from the ophthalmoscope for 10 seconds and measuring the time taken for acuity to return to within one line of pre-bleach acuity. Subject with normal macular function should be able to read line in 50 to 60 seconds. Photostress test: pathological states that affect the photoreceptors, Bruch's membrane, choriocapillaris, or choroid can prolong visual recovery time. No such prolongation is observed in diseases affecting the neural conducting pathway. The second important test is the ampular grid test, which is very, very important. It evaluates 10 degrees of visual field centered on fixation used in screening and monitoring macular disease. Square 10 by 10 centimeter divided into 405 by 5 millimeter squared to be held at a distance of 30 centimeter in front of the patient, and also we have 7 charts. Reading glass: the patient should wear his reading glass and cover the other eye. Patient is asked to see the central spot and detect the presence of abnormalities like blurred area, holes, distortion, and blank spots. Patient with maculopathy reports that the lines are wavy, whereas patient with optic neuropathy remarks some lines are missing or faint. We have this chart. A space-taking pathology such as tumor that forces the cones closer together will cause the grid to be seen distorted. The lines of amphilar grid will be seen as larger and bend outward. This is known as macropsia. A patient with macular edema that forces the cones apart will stimulate fewer cones than normal, and the lines of the amphilar grid will be seen as smaller, a condition known as micropsia. A combination of squeezing and spreading will call it metamorphopsia. This is this chart is to evaluate the centrocecal scotoma and macular edema and so on. Fluorescein angiography and endocyanin green, we are all familiar to it, so there is no aim for discussion now. Now we come to the most important item in my talk, is the optical coherence tomography, OCT. OCT is a non-invasive and non-contact imaging that produces a high-resolution cross-sectional image of the anterior eye and the retina in vivo, useful in diagnosis macular disorders and to delineate retinal layers and to detect subtle abnormal changes. Clinical applications posterior. We have a macular hole, macular edema, age-related macular degeneration, central serous, chorioretinopathy, epiretinal membrane. And just to have a retinal pigment epithelial detachment and serous detachment. We have some example pre and post-operative. A patient with macular hole pre-operative with best-corrected visual acuity 0.5 and 3 months later on the vision improved to 0.9. Another example, a patient with macular hole, we did vitrectomy. Pre-operative best-corrected visual acuity is 0.05 and 3 months later the same vision. There is no improvement. Why? Because there is central serous retinopathy. Another example, pre-operative best-corrected visual acuity 0.05, best-corrected visual acuity 3 months later after operation 0.1. The last example, pre-operative best-corrected visual acuity 0.05, 3 months later 0.2, improved very much. I think the Professor Nihal will cover the remaining part of OCT. Pupillary reactions, swinging light test is used to detect a relative afferent pupil defect. The test can be very useful and very easy for detecting unilateral or asymmetrical disease of the retina or optic nerve. Pupillary reaction, we have it maculopathy, unless very severe, this is not usually associated with a relative afferent pupillary reaction. Extensive retinal damage, major retinal vascular occlusion or retinal detachment by contrast can lead to a high-grade retinal relative afferent pupillary reaction. We have another very simple test. We can all do it in opaque media, Maddox rod test. It's a simple and reliable test, and it can be used in semi-opaque media. Patient is asked to fixate light at a distance of 30 centimeters through a Maddox rod with opposite eye occluded. Any breaks, hole, discoloration, or distortion indicates a macular lesion. Visual evoked response, I think we don't rely on it very much. We have a flash of light and pattern stimuli, pattern appearance, and pattern reversal. This is enormous. Now we come to confocal scanning laser ophthalmoscopy, that is HRT. We have this modality in our faculty since 10 years, and it is very effective, but the new era, now there is a good HRT. Non-invasive investigation that has been used initially to receive three-dimensional images of retinal surface in vivo using diode 670 nanometer. The commercial name of the device is Heidelberg Retina Tomography. HRT is a powerful tool for aiding in the diagnosis and management of retinopathy such as age-related macular degeneration. Look at this curve. The upper one is normal, where the lower one is wider and indicative of macular edema. Lastly is the ultrasonography B-scan. We don't rely on it very much, just to give an idea about the macular edema and posterior staphyloma. Home messages. Evaluation of the macular function of a patient with opaque media is a challenging problem commonly faced by us with all ophthalmologists. New macular function tests are becoming available, which can provide useful insights into retinal pathology and which may provide a more accurate assessment in patients with macular disease. Thank you very much for your attention.